Allergic rhinitis is an inflammatory condition affecting the nasal passages and eyes, triggered by an immune response to otherwise harmless substances known as allergens. It affects millions worldwide, causing significant discomfort and impacting daily life. When an individual with allergic rhinitis inhales airborne allergens like pollen, dust mites, or pet dander, these particles land on the moist lining of the nasal cavity, the mucosa. This is the initial point of contact where the allergic cascade begins. The immune system, specifically mast cells within the nasal lining, mistakenly identifies these benign particles as a threat. This hypersensitive reaction involves immunoglobulin E, or IgE antibodies, which are presensitized to specific allergens. Upon exposure, the allergens bind to these IgE antibodies on the surface of mast cells. This binding triggers the mast cells to degranulate, releasing a flood of chemical mediators, most notably histamine. Histamine causes local blood vessels to dilate and become more permeable, leading to tissue swelling and increased mucus production. These physiological changes manifest as the classic symptoms of allergic rhinitis. In the nose, inflammation and excess mucus cause congestion and a runny nose, while nerve irritation leads to sneezing. Simultaneously, histamine release in the eyes results in redness, itching, and watery discharge as the conjunctiva becomes inflamed. With repeated or prolonged exposure, the nasal lining can enter a state of chronic inflammation, becoming even more sensitive to allergens. This explains why allergic rhinitis can be a persistent seasonal or year-round condition for many individuals. In summary, allergic rhinitis is a chain reaction. Allergen exposure prompts an immune overreaction, leading to histamine release, which in turn causes the inflammation and symptoms that define the condition. Understanding this pathway is key to managing its effects effectively.